Hello, everybody. It's Amber. I'm back for part two of our working with students with special needs, disabilities in the school setting and the music education. So I'm glad you chose to click back on and do part two. This is a 4-part series, so hopefully you'll be able to join us for all four, or at least choose the ones that are directly relate to the students you're working with. That'll be most helpful. So the next two disabilities, so the first two we did in part one was students with autism and students with intellectual disabilities in music education. And so these two are significant developmental delays and emotional behavior disorders. So I think these are also two that are all in your classes and your daily lives in the world of music education. And now this first one, so those of you working in the secondary education, this first disability is not really going to apply to you because this label system that they have is only applicable to through the age of 9. So I still stay and listen, especially because this next one after this, emotional behavior disorders, you absolutely going to want to hear. So you can fast forward if you need to get to that part. So let's talk a little bit about significant developmental delay. So with the reauthorizations of IDEA, and remember I talked a little bit about the two big bodies of law, the 504, which was 1973, and IDEA, which was 1975. And with IDEA was the development of that process of things that were the legal rights for students and parents in the areas of special education, with the zero reject policy, due process in place, non-discriminatory evaluations, and then the individual educational plan. And with all that, a few years later, probably several years later, actually, with one of the reauthorizations, became the significant developmental delay category. Because our students, as we know, which I'm not sure that everyone does realize this, but according to your disability category and what the students have and have been diagnosed with, there's federal funding kind of attached. So the more involved the child is with low functioning, needing extra supports in place, the more money that is supported by the federal government. So significant developmental delay is ages 3 through 9. 3 through 9. Okay, so I'll look at this. Let's read a little bit about this definition. Now, remember, some of these get a little thick and a lot going on, but I think it'll help you better understand the kiddos in your classrooms a little bit more. And you'll understand what we're looking for, why we're teaching the way we're teaching, and why they need what they need. So a delay, this is a 2020 definition, so this is a very current definition. A delay in a child's development in adaptive behaviors. Remember, that's self-help, that's functional behaviors, that's self-determination, decision-making models, cognition, that's academics, cognitive IQ levels, communication, motor, emotional, to the extent that if not provided with special interventions, the delay may adversely affect a child's educational performance in age-appropriate activities. Remember, they're 3 to 9. The term does not apply to children who are experiencing a slight or temporary lag in one or more areas of development, or a delay which is primarily due to environment, cultural, or economic disadvantagement, or a lack of experiences in age-appropriate activities. The STD eligibility may be used for children from ages 3 through 9, the end of the school year in which the child turns 9. Okay, now, so in the state of Georgia, we have a program called the Babies Can't Wait program. And Babies Can't Wait, literally there are caseworkers assigned to mamas and daddies, even is in the hospital when little ones are born, knowing in advance that there's going to be a disability or there might be a problem earmarked in advance in utero, that you are met with a caseworker who begins to help you navigate the system of special education, kind of navigate, well, what does my kid need with supports? You know, is it too young to start speech? Because speech is also a part of feeding. And do they need some more fine motor if they're just a baby? And do we need to look at occupational, or maybe they have gross motor delay, so they need physical therapy? And so, remember, occupational therapy is fine motor needs and other things. That's a simplicity of an answer. And physical therapy is gross motor needs, larger motor needs. So then you've got this little one that's even in the hospital, they know. And so they are a part of the Babies Can't Wait program. And so this caseworker is assigned to the parents, and they support the parents through the decision making and maybe try this and let's look at this and maybe this. And they kind of help navigate the system. And when that kiddo turns 3, public education is put into place for students with significant developmental delays. So we kind of literally take the kiddos the day they turn 3. And I've had lots of them that the day they turn 3, they come to music because I have them, and they come toddling in their little cute selves, and I'm singing happy birthday to them. And they're all of 3 years old. Now, part of this whole process is getting them in, because early intervention is the key, and we know that. Now, remember, they know that there is a delay in some of these areas that's mentioned in this definition, but they don't really have a diagnosis yet of other things besides this. So this is where they start kind of earmarking and paperwork and qualifying, getting kids into the program because they've qualified under this disability. And then while we have them in our preschools and our special needs preschools and special needs kindergartens, we're trying to really figure out what is more of their primary diagnosis. And so this is done through further testing, through working, and the kid getting older and learning skill sets. And as they get older and into their kindergarten year and first grade year, that's when we start really looking at, is their primary disability category more intellectual disabled? Is their primary disability more autism spectrum disorder? Is their primary disability more fill in the blank of these other disabilities? But when they're that little, this is when they're 3, they're going to get this SDD, even though it might be clearly, it looks like intellectual, or it might look clearly like it's autism. They kind of start here because this is kind of where we begin. We begin our processes, we begin our testing more, we begin our interacting more with the kiddos. So for you in music education, you may not get these little ones at 3 and 4, unless you're teaching those inclusive preschool classes, which exist in our county. I don't know if they exist where you're at, but I work with the inclusive preschool classes. And that means that, it's like the government funded lottery programs for the 4-year-olds, not those, but a model that is similar. They're still 4-year-olds, but there are 14 typical 4-year-olds, and then 6 with an IEP, with an SDD label most of the time. And this is where we get them included with gen ed kiddos, inclusion, and they're learning, they've got good models, they're working together in groups, or they're seeing that that's not a supportive model. They need more support and more structures in place. So they might not be in that kind of environment. They might be more of a special needs preschool. But in music education, these littles show up for your world in kindergarten. So in kindergarten, a lot of them may be coming for the first time to kindergarten, having not had any of the supports in preschool. And now the kindergarten teachers and you as their music educators have these kiddos in your classroom. So what do these characteristics look like of these? And you could probably feel this, these general music teachers who are watching this, you're like, you got kids in your head as I go through this. You're going to say, oh, that's just like such and such and such and such and such and such. And this is kind of why they have that SDD, because they're still young and they're still trying to figure out where they are in the developmental, because some things are developmental. Some kids just developmentally get there differently at different milestones. It just takes them a little longer to get things done, but they might very well get them done. And just because you had an SDD label, you might very well go into just an interrelated resource support model, pull-out model, and eventually maybe you might get, kids graduate from special education. It's not a life sentence. You don't stay in there forever if you don't need the supports in place. So again, you might need the support early on, but kids might not need it later on. They might end up completely in all general education for the rest of their careers in public education. So let's talk about some characteristics. Learning and developing more slowly than other children same age. So that's kind of a little marker for some parents, especially if you have multiple kids and you kind of like, wow, such and such was doing this already. Why is she not doing it? Or why is he not doing it yet? Difficulty communicating or socializing with others. So maybe that means that there's some signals that are making you think a little bit, maybe there's some autism going on. Why are they not socializing more? Again, remember early on, they're not going to necessarily get that ASD label. At 3, they're probably going to get more of an SDD label. Lower than average scores on IQs. Again, that's kind of an intellectual disability categorizing that would happen eventually, but at 3, they're kind of more in here. Difficulties talking or talking late. There's some kids that are cognitively going to be fine. They just don't talk as quickly as others, and sometimes that's developmental. Having problems remembering things. I could say that could be me at times. Inability to connect actions with consequences. That's sometimes the behaviors of 2 and 3-year-olds. Difficulty with problem solving or logical thinking. Again, this is above and beyond what's typical for typical 2 and 3-year-olds. Trouble learning in school. Again, if they've not been at school before, maybe the structures are difficult.